Skin cancer is the most common type of cancer in the UK, and here are the top 3 skin cancers that we see in our clinic. Hi, I'm Dr.ErmaDerma and I'm a dermatology registrar doctor, and there are 2 main categories of skin cancer: melanoma and non-melanoma. So let's go. Melanoma is a type of skin cancer that develops from the pigment-producing cells known as melanocytes. These cells are responsible for producing melanin that gives pigment to our skin, hair, and eyes. Melanoma is considered the most serious and potentially deadly form of skin cancer. Melanomas can occur anywhere on the body, including areas not exposed to the sun. They often appear as new, unusual, or changing mole or pigmented growth on the skin. Melanomas can vary in appearance, but some common signs to watch for include asymmetry, so one half of the mole does not match the other half; border irregularity, so the edges of the mole are ragged, notched, or blurred, basically it's not a smooth, round mole; color, the color may have loads of different colors in them, such as shades of brown, black, pink, white, red, or blue; the diameter, the mole is larger than the size of a pencil eraser, basically about 6 millimeter or over; evolution, the mole changes in size, shape, color, or it starts to itch, bleed, or crust over. So this is the ABCDE rule to watch out for with your moles. Any new or changing moles should be examined by a dermatologist to determine whether it might be a melanoma or a normal mole. Early detection is crucial for successful treatment for melanoma. If diagnosed at an early stage before it has spread to other parts of the body, melanoma is highly treatable. Treatment options include surgical removal, targeted therapy, immunotherapy, chemotherapy, and radiation therapy, depending on the stage and the characteristics of the melanoma. One app that I recommend is Me Skin app. It tracks your moles all over your body, and it can also detect which moles actually changed in size, shape, or color. So now in the realm of the non-melanoma type skin cancers, one of them is called the squamous cell carcinoma. It's a type of skin cancer that arises from the squamous cells, which are flat, thin cells that make up the most outermost layer of the skin. It's the second most common type of skin cancer after basal cell cancer. Squamous cell cancers usually develop in areas of the skin that has been exposed to the sun, such as the face, ears, neck, lips, and back of hands. Squamous cell cancers can vary in appearance, but it often appears as a scaly red patch, a firm bump, or a sore or an ulcer that doesn't heal. Some key characteristics of squamous cell carcinomas include them being rough and scaly. The lesions usually have a rough, scaly, or crusted appearance. They can be reddish in color. The affected area might be red, inflamed, or have a pinkish hue. There could be an elevated bump. Squamous cell cancers can present as a raised bump or lump that may be firm to touch. And there could be a persistent ulceration or a sore that doesn't heal, or it heals and then reopens. They can be quite painful. Some squamous cells can be tender, painful, or cause itching, and they can grow and increase in size over time if left untreated. While many squamous cell cancers are related to sun exposure, other factors are weakened immune systems. Certain genetic conditions can also contribute to their development. If left untreated, squamous cell carcinomas can become invasive and spread to other parts of the body, although this is less common than with melanoma. Early detection and treatment are crucial for preventing its spread. Treatment options for squamous cell cancers include surgical removal, radiation therapy, topical medications, and in some cases, targeted therapies or immunotherapies. The third type is the basal cell cancers. So basal cell cancers is a common type of skin cancer that originates in the basal cells, i.e. the bottommost layer of the epidermis, which is the outermost layer of the skin. This is a type of cancer which you do want to have out of all the other type of skin cancers. Basal cell carcinoma is the most common form of skin cancer and typically occurs in areas of skin that has been exposed to the sun, such as the face, neck, scalp, ears, and shoulders, just like squamous cell cancers. Basal cell cancers often appears as a slow-growing raised bump or nodule on the skin. It can also take on other forms, including a flat, pale, or translucent patch, or even open sores that don't heal. Some characteristics of basal cell cancer include a pearly appearance. Basal cell cancers usually have a pearly or waxy appearance. The edges of the lesion may be rolled or raised. The lesion might have visible blood cells on the surface. Open sores. In some cases, the lesion may become an open sore that oozes or crusts and just never heals over. Slow growth. So basal cell cancers typically grow slowly over time and it may bleed or become ulcerated. Whilst basal cell cancers usually doesn't spread to distant parts of the body and doesn't spread inside the body, but it can invade nearby tissues and bones if left untreated. Basal cell cancer is usually caused by long-term exposure to UV radiation from the sun or artificial sources like tanning beds. However, genetics and history of skin cancer can also play a role in its development. The good news is that basal cell cancers is highly treatable, especially when detected early. So treatment options include surgical removal, Mohs surgery, which is a specialized technique for removing skin cancers layer by layer, cryotherapy, topical medications, and in some cases, radiation therapy. Regular self-examination of the skin and routine checkups with a dermatologist are recommended to monitor for any changes or suspicious growth. Protecting your skin from excessive sun exposure and using sunscreen can also help reduce the risk of developing melanoma and other types of skin cancer. So this is your reminder to always wear sun protection when you go out in the sun, and always cover up in the sun, so use sun protective clothing. I hope this helps, and I hope you don't see any dermatologists with these 3 skin cancers. If you like this type of video content and information, then you may want to subscribe for more skin related information just like this. Thank you for watching.